Good morning. I want to thank everybody for joining us today for the AHRMM webinar, The Manufacturer and Distributor Perspective on Building Supply Chain Resiliency. I'm Karen Conway. I have the pleasure of moderating today's webinar. I also had the distinct pleasure of serving as the chair of AHRMM a few years ago. Currently work as Vice President of Healthcare Value at GHX. This webinar is part of a series of webinars of CQO thought leader discussions about re-engineering the healthcare supply chain, particularly in light of COVID-19. These webinars are made possible through the generosity of AHRMM's CQO, or Cost Quality Outcome Movement sponsors. We want to give them our thanks: Vizient, Cook Medical, Health Trust, Premier, Nexera and Acurity, and Pampers. The AHRMM CQO movement, we launched it in 2013, and it was really designed to frame the very critical role that supply chain and supply chain professionals play in driving high-quality care at a more affordable cost to deliver greater value to patients. And I would say that people are recognizing the importance of the supply chain as we're going through this very challenging time. A few housekeeping items before we get started. All phone lines have been placed in listen-only mode, but you can ask questions, and we do encourage you to do that, by typing them into the Q&A box. The Q&A box can be opened by hovering your mouse at the very bottom of the WebEx browser, at the bottom of the screen, and then clicking on the ellipses icon, or it's easier for people like me, the three dots. If you click on that, and click Q&A, that will pop up usually to the right side of your screen where you can type in your questions. We will do the Q&A at the end after we've had some discussion with the three panelists, but I encourage you to go ahead. If you've got a question that comes to mind, go ahead and put it into that Q&A section. And now I'd like to introduce you to our three healthcare supply chain leaders who have joined us for this call. Today's panelists are Christine Army, who is the Vice President of Healthcare Systems and Strategic Channels at 3M Healthcare Business Group, Lisa Holman, who is the CEO of Concordance Healthcare Solutions, and Ruben Taborda, Senior Director of Hospital and Distributor Supply Chain Solutions at Johnson & Johnson. I want to thank all of you very much. I know from some of the preliminary conversations we had preparing for this that there is a wealth of information, and it is so important to hear from all of the various stakeholders. So in the title for today's session, we use this term, supply chain resiliency. And Webster defines resiliency as an ability to recover from or adjust easily to adversity or change. And I would say we've had our share of adversity and definitely our share of changes throughout this. So we're going to talk a little bit about that with our first question to the panelists, but I also wanted to share some results of the survey and thank the participants today. By the way, we have over 200 participants, or registrants for this, and I was very, very pleased to see that it was a real mixture. A lot of hospitals and healthcare delivery systems, a lot of suppliers and manufacturers and distributors, as well as we had GPO representation, we had consultants, tech companies, a lot of the many, many stakeholders that go into the supply chain. And so you responded to some questions, and I'd like to share those very quickly, asking what was the biggest challenge. And I think that it comes to no surprise that the winner in this poll, if that's the right term, or the primary response was this inability to source critical personal protective equipment supplies. If we can go to the next one, we have a bit more of a mix. We asked the audience, and this is really where we're going to be discussing today, because we're looking for how do we improve things. And so we asked about what do you think will be the biggest impact going forward And this is where we have a bit of diversity. Not surprising, and we'll talk a little bit about this, is this more prioritization of domestic manufacturing, so products produced in the United States. And this is quite frankly a discussion that's happening in countries around the world. The close behind, though, was this concept of more inventory and demand planning, data sharing between the various parties on the buy side and the sell side, and I would say other critical parties. And then coming in third was this less reliance on just-in-time distribution or more safety stock. And then you can see, again, more investment in inventory visibility, because that's going to be critical. If you're going to share data, you have to have visibility to the data. So we'll probably talk about a few of these, but I don't want to waste any more time, and let's get to the, because we've got quite the brain trust. So I'd like to start with a question to all of the panelists. And this is again talking about the fact that, so we've got representatives from the supply side, but the supply chain, and I think this particular crisis has gotten people to recognize that supply chain is an end-to-end system with many, many parties. So thinking about that definition of resiliency, I'd like to ask each of the panelists, if we were to face this kind of pandemic again, what is it that you want to make sure that is in place? Or what do you think, what factor or factors would have increased our resiliency? And I'm going to start with Christine, just because I'm going to go left to right, if that's okay. So Christine, any thoughts on that? Christine, we may have you still on mute. I'm going to jump over to Lisa.
Okay, can you hear me now?
Yes, we can hear you. Perfect. This is Christine,
okay.
Right?
Yes. All right, good morning.
Perfect.
Thank you. Sorry, apparently I had to unmute on both my phone and the computer, so I'm rolling now.
Okay, great.
Yeah, so the list for me was pretty long, but as I really thought about this, the one thing that I realized immediately is that we all impact each other, right? And so we have distribution, manufacturing, providers, and so I think that congruency and communication amongst all of us is super important. In that, when everybody pushes the emergency preparedness button at the same time, the ripple effect that has and what it had across the United States. And so as we operate, many of us in the world that we are in just in time versus just in case, I think we need to look at that moving forward, and that can definitely impact whatever the next hurdle is that we cross. But also technology and analytics and identifying gaps and surpluses. So I think that's another area we could spend some time and focus on as we move forward.
Very good. Thank you. Lisa, thoughts on this?
Good morning, everyone. Thank you for joining us. So when I look at this, I look at it kind of more holistically. We spent, I know the key distributors spent countless hours working with the federal government kind of on the response. So I'm going to take this question kind of a little bit on a different way. But I think that there were a lot of lessons learned in the strategic national stockpile, how that was utilized, how we can better improve that, how you improve communication. That was probably the biggest challenge in all of this, is how do we make sure we have a resilient supply chain that's both commercial and government supported, so that we kind of have a backup on both sides, and to make sure that that product is viable, sustainable, fresh, and that it can be delivered rapidly to the places that need it the most, and kind of what are those parameters and how you decide those things. So I think if that pre-planning is done up front, and I know that they're working diligently on revamping kind of the strategic national stockpile, and it's how it's utilized and how it's communicated. I think that can make a huge difference. So I think us as as an industry and as partners between manufacturers, distributors, and end-use customers, and how we work with the government to ensure that there's, really good alignment, and so that we can plan both specifically in our own business and then planning how the government's going to support us in that when we do have a pandemic or an emergency response. I think it's really critical that we have good alignment and education in that process.
I think that you bring up a very good point, Lisa, because, normally it is the commercial supply chain operating. Certainly the FDA, CMS, they play a role in approving products, in reimbursing products, et cetera. But generally speaking, of course, we have DOD and VA playing an important role all the time in delivering care. But it's kind of like you have to flip that switch for when we're in an emergency and the government becomes much more important. But, how do you plan for that? I think that's another important stakeholder. Ruben, thoughts from the manufacturer perspective?
Yes. Can you hear me okay?
Yes.
Perfect. So not to be duplicative to what Christine and Lisa have said, but I would add that there are probably three areas that I would reinforce that would have been an improving situation for us. One of them is all around, if I have a circle, it's all around collaboration. And the more we could collaborate with our partners on a regular basis, and when I mean regular, it's almost weekly, monthly, on a certain topic. In my world, it's all around inventory and replenishment and par values. So like that, we have a sense of what's needed at the hospital, and when demand starts to decrease or pick up, that would be really key.
My background comes heavily from consumer, and I am finding that the tactics in consumer where you're meeting and collaborating on a weekly basis around replenishment isn't necessarily followed in healthcare. And that's something that we could really improve upon. So one of them is around collaboration. The second one is around increased digitization of anything from demand sensing, when product is needed, to procure to pay automation. The greater we can digitize the supply chain, the better it's going to be. And then the last one is to continue to improve on visibility and traceability, right? So it ties closely to the digitization effort. But, we don't know where things are, right? We don't know when they're needed. There's no indicator to us on when we should make. So we are in a world of make to stock, but we're basing it on a forecast that's generally filled with errors and assumptions. So we guess a lot. And as a result, we tend to miss it, particularly at the SKU, weekly, region of the country level. So Karen, those would be the three areas that I would highlight, collaboration, digitization, and visibility and traceability.
And what I really like listening to all of these different perspectives is it's really all kind of circling around a similar theme, kind of starting with Christine saying, if everybody turns on the emergency switch at the same time, we need to have that ability to respond. But to your point, Ruben, you've got to have, you've got to understand, where the demand really is. And then Lisa, as you said, there are other players that are absolutely critical when we hit this kind of demand in face of reduced production, just given the pandemic. So really appreciate all of your perspectives to that. I want to jump into a question about that's driven by the responses from the audience, and that is this this idea of there have been many calls by many organizations and the government to increase domestic production or to secure more domestic supply sources. I'm wondering if I'd like to ask a couple of the panelists about if you're making changes in this regard, and if so, how? And then I think also kind of adding that fact, as I mentioned, every single country is talking about this. And if you're a global manufacturer, you're serving customers around the world. So looking at that, maybe start with you, Christine. 3M certainly has been absolutely critical in this response, and interested in your thoughts on this topic of increasing domestic production or availability.
Okay, thank you. So as a global manufacturer, this is one where, we as a St. Paul-based company, we have made significant investments in manufacturing within the United States. And so as we moved forward in the last 4 months and as we embarked on this, what was interesting to find out was that we were one of 2 manufacturers for N95 respirators in the U.S. And so, we were lucky that we manufacture in the U.S. for the U.S., and we are continuing to make investments in that. So if we're making any changes, yes, we are expanding lines within the United States to support that. We manufacture in China for China, and we were able to, tap into other resources that we were able to pull into this space. One of the, pieces or components, one of the N95s happened to be made outside of the United States, and we felt an impact from that when the borders closed and when the EU, put border restrictions in place. And so from that, those lines will be coming here. So it's interesting as you look strategically around the globe where to place manufacturing, but we've never left the United States. We continue to invest here, and we will do so moving forward.
Thank you. Lisa, a distributor perspective on this topic.
This is one of these that's kind of near and dear to my heart. So as a member of SMI, we had started a discussion around supply chain continuity because it's not only in a pandemic, and the pandemic brought it to everybody's, it got heightened visibility because of the pandemic, but I look back to 2001, if our borders close, if we have, some type of chemical warfare, like all of these things are threats within our, in our world today. So how do we as a nation and as an industry partner together to ensure that there is ample supply on key products, both within our country and then within, North America, and making sure that it's really how do we develop and work together to start ranking kind of the supply chain resiliency on product types, because this is not something that's going to go away today. And I will tell you, just getting product, a lot of product moved to China, and, because of a certain reason, right? Because reimbursements went down, everybody drove to lowest cost of ownership, lowest price. But when we are partnering, I think we as an industry have to be very careful about what countries we're partnering with, because we continue as an industry, as suppliers and distributors, to have issues getting product out of China. They are continuing to put things in place that are just huge hurdles that is also disrupting the supply chain. So I think together we have an opportunity as an industry to come together and start scorecarding kind of what countries are friendly, what countries aren't friendly, and ranking kind of supply on these critical items. It's not going to be on every item, obviously, but if we look at a pandemic or any type of response, there are key categories that I think we would be remiss if we do not figure out a way to have that production in the United States, in North America, and how do we ensure that this doesn't go away in 5 years? Because I think as a country we have very short memories, and how do we make sure that, one, the government is going to reimburse our healthcare providers appropriately so that they can afford product that is made here, and then to ensure that we are sticking to providing suppliers like 3M demand so that they can continue to produce in the United States. So I know the government's done some work with the DPA and providing some funding, but I think that has to continue. And I think we need to be able to track really back to location of supply, where it's made, where raw materials are, and I know there's some work being done on that. But I think this is a critical subject that we should all be paying very close attention to and figuring out as an industry how we come together and really put our our collective thoughts and efforts around this initiative.
I think, one of the key points you made there, Lisa, is that this is an industry challenge. This is an industry problem, and I would agree with you personally that we need to figure this out together, all the different stakeholders. Yeah. Ruben, I want to kind of continue this conversation, but ask you a more specific question, and that is in terms of what kind of strategies do you have in place, or are you considering to increase this kind of resiliency based on some of the lessons? And that could be changes that you're making within your own supply chain operations, whether that's upstream or whether that's downstream in terms of, because I know you focus a lot on how J&J is servicing its various customers. Some thoughts there. Ruben, I think you might be on mute.
Apology for that. Can you hear me now?
Yes, we can.
Yes,
thank you.
Thank you. So yeah, the function that I have that I get to support is really within the four walls of the hospital systems. I collaborate a lot with inside my supply chain to ensure that the package is left at the front door, if I can use the Amazon analogy. But in reality, what we do is we have a team of SWAT people to go inside the IDNs and try to really streamline the interface between us as a manufacturer, a supplier, to a hospital system. The areas that have been the strongest where I've seen it is going back in this area of digitization, right? We have really seen an acceleration coming from the IDNs on how can we start to, for example, transact on GTINs and start to leverage the GDSN system. Again, all goes back to visibility and traceability. How can we start to transacting on that a lot more? In the area of making sure that we're automating our procure-to-pay processes, what can we digitize through EDI? Just with a perfect example with HCA, we dug into the amount of manual effort HCA was going through with paper on invoicing, and roughly 45% of a portion of their business was all manual, and it had shifted to that because of processors weren't solid at the get-go. So we got all that digitized. When you think about the amount of work that we do with hospitals, we break it up into three buckets, right? One of them is around getting a perfect order. Second one's around inventory management, and the third one is just more advanced logistical supply chain solutions. And Karen, before it used to be like 50% of our workload was perfect order, and the remainder was the other two. That shifted almost in like 90% perfect order for all the hospital systems around the country. And this really it supports the remote work, right, where you can do this type of work and work with a supplier to digitize a lot more. So we've seen an acceleration of these solutions in a much stronger light outside of the typical work that we do inside to ensure business continuity plans are there. Similar to Christine's effort, we're a global company. We have to source from multiple locations as part of a business continuity plan, and those stay as is. But the more that we can work on the interfaces between us and the IDN to know what they need, when they need it, in a digitized format and collaborate around that is really what we want to accelerate and continue to focus on for improvement.
Karen, you might be on mute.
Thank you. You would think I would have learned this by now. Thank you, Ruben. And you mentioned standards, and I think that's an important piece of this because, one, it's kind of creating that visibility, having a platform where you can share data, but, if you could have the platform, but if everybody's speaking a different language, that makes that a lot more difficult as well. I'd like to move into, as we're thinking about, many of the hospitals and healthcare systems that are listening in and that are your collective customers or respective customers, many of them have already moved to start resuming elective or non-urgent care. So wondering what are the things that you are doing in your organizations. Lisa, I'm going to start with you first in terms of being able to help hospitals, and what can hospitals do, because it's interdependent, to help you help them, if you will, as they're looking to try to get back to some of these procedures that have been deferred for quite some time now.
Thank you, Karen. So the biggest thing I think is communication, and to Ruben's point, demand planning. So past, just the PPE items that are needed, we have, I think, at least in our organizations and with customers and suppliers, really have changed kind of that planning, the demand planning. Before, it used to be very reactionary, and it used to be based on kind of some normal average over a historic period. But that doesn't work today. So we've been really working hard with our customers to do forecast demand planning. How many, do you think you need today, tomorrow, next month, and really getting commitments on those to help our suppliers then plan appropriately. So that's, all in the PPE, but now that elective surgeries are opening, that's going to be the same type of issue. So if you look at distribution and how normal distribution works, we had product on hand, say you have 30 days on hand, elective surgery stopped, so we still have items in the pipeline, so now you might have 60 days of demand, give or take, 45 to 60 days for all these surgeries, right? So whether they're packs or sutures or whatever, the items that are needed for all of these surgeries that have not moved, much, right? So now if you're going to start to reopen, it really has to be a very robust communication with the customer, the distributor, and the supplier, because we can't just say, hey, everybody's reopening back to normal levels. Some states are reopening. Other states are fully reopened. There's requirements based on the state that you are in, so keeping all of that clear and concise. But this is really an opportunity for us to communicate better with the customer and develop out, to Ruben's point, some really robust demand planning. And I think that only helps us in the future when we go back to whatever the new normal may be, is to keep that information flowing between customers and suppliers and distributors, because I really think it can improve the entire process. But right now, communication is absolutely key, and as you reopen, it has to be, if you're using a distributor, or even if you're not and you're going directly to suppliers, you have to make sure that you're communicating very rapidly and consistently, so that supply can keep up with the demand as those are reopened. And digitizing the information is critical, right? Doing this manually is insanity. So anything we can do to increase that, I think, only helps the entire supply chain, both as we reopen and in the future as, we go back to some new normal.
And what I really like, Lisa, is you talked about, and this is kind of that role of the distributor. You're working with your customers, but at the same time, you're thinking about how can you help the suppliers that are providing the product that you're distributing. Ruben, you mentioned earlier about your experience in retail, which does demand planning a bit more as a matter of course. Interested in your perspectives on this question.
So, we back in maybe I'm dating myself, in the late 90s, early 2000s, the whole concept of collaborative forecasting and replenishment was a concept that Walmart and Target really initiated with us, and other retailers too. And the whole emphasis was to key on consumer metrics of importance, right? And we centered on 1 to 2 that were really critical. For sure, cost improvement and how we interacted with the retailer was one area, but the second one was on in-stock fill rates, which is the product in shelf, in stock on shelf. and everybody can collaborate around that, because if the number's low, it benefits nobody, right? So, and we found that in 30% of the cases, the retailer had ownership to a broken process, but in many cases, 70% of it was our fault. But no matter what, if it's a back and forth thing, when we did have back orders, there were still issues, and that's what we need to find. What's that key measure or set of measures that we both can collaborate on with hospital systems? And as I'm doing GS1 work with a few hospital systems around G10 transaction, particularly around trauma as a starting point, we're looking to see how we can install systems that allow us to collaborate on that thread of information. Like, for example, what's the takeaway of a trauma part? Because trauma is so wide in SKU count. Are the par values set correctly? Where do we see things getting old? Because then you have obsolescence. Basically, where it's joint inventory planning is what it is. So, we're finding that the more we can beef that up, the more communication opens up across not only, the replenishment, but also other areas of pain with the customers, because logistics are such interconnected processes. So we're just taking what we did in retail, where in retail they shared that, in-stock information and demand forecast to us, and trying to do the same exact thing with healthcare systems. Now, granted, it's using a J&J proprietary system, but if we get to a GS1 environment where we're transacting on G10s, we can pursue the exact same methodology and format.
Very good. Christine, do you have thoughts on this particular topic?
Yes, thank you. So one of the, aside from obviously continuing to do whatever we can to provide more respirators into the marketplace, that's a given. But in addition to that, we've been working very closely with AHRMM on helping bring back surgeries, in two specific areas, providing input and help and getting this information out to help patients feel safe to come back, right? So that you have those elective surgeries and patients coming back into the door. And then in addition to that, helping with some consistency and standardizing the requirements for the reps and clinical teams that you need to help support those surgeries that are opening. And so a lot of progress is being made there, and some recommendations coming out of that with other agencies that are in full support of it. So we are all in this together, and we know that these financial burdens are difficult, and so getting back to surgeries and getting that back opened up is the best path for all of us. So.
And what I like is each one of you keep coming back to this idea of communication, of collaboration, and some very specific examples. So while it might have been, 10 years ago we were talking, or longer, 20 years ago, about these concepts, things are actually happening. Question is now how do we take it to scale? Let's move on. So we're resuming elective, non-urgent care, et cetera. I know there's a lot of hospitals and healthcare systems who are really doing some outreach to try to get to some of those patients who may have deferred care on their own, either from fear of going to the hospital, or I read something the other day about a very at-risk patient who didn't want to bother his doctor during this particular time. But, we are going to get back to some semblance of normal. The question then is this do we have to do a complete revamp? I think about, when Hurricane Katrina hit New Orleans. One of the outcomes came is because there was such devastation that they really were trying to rebuild their healthcare system from the bottom up. Do we need to revamp our supply chain, or do you think it's more about specific changes in specific areas? Christine, I'm gonna continue the conversation with you on this particular topic. What are your thoughts? Complete revamp, or are there areas you would prioritize our work right now?
So the first thing that I will comment on is normal. You mentioned normal, and to me that would imply a state of stable condition, which I definitely don't think we're there yet, right? Anyone who knows me or knows me well knows that I love dogs. So I'm gonna quote something you've heard before. My favorite dog, Toto. We're not in Kansas anymore, and we're not. I don't think we know exactly where we are at this point, but we know where we're not. And unlike Dorothy, we're not going back where we were. And so we are working to try and better understand as we come through this, what will demand be? What will this look like since we aren't going back? And so in times like that, when you've had such a major disruption and an unprecedented event, I think it does beg the question, should we look at, is this time to talk about a full revamp? I think we should discuss all different opportunities or thoughts because it was so disruptive. At the end of the day, we may end up deciding collectively, and I go back to this collaboration because we all impact each other, but collectively that maybe it is only a few tweaks. Maybe it is, our healthcare model is so different between, if you look at the way we contract, the way that we supply, the way that we, operate as an industry together is so different from consumer, it's different from industrial, it's different from a lot of other industries. And so there could be some things, and now might be the time to evaluate whether, the current path that we're on is the right one, or that, maybe there's an opportunity to be more efficient, more effective as we all come out of this. But I think things are still very raw. And so, and as, we hear this morning that, there's certainly surge happening in certain areas of the country, and there probably will be in a few more weeks, given what's happened recently, and then as people try to prepare for fall. So I think that we still have to continue down the path that we're on, staying very focused on the short term, but start these discussions about what long-term means once we start moving forward. And inventory management, sourcing, and potentially contracting might be all up for topic.
Thank you, Christine. Ruben, do you have any thoughts on that? Total revamp or areas, you've spoken to a few of them, but any other comments you'd have in terms of where we should prioritize?
Karen, I've really seen the benefit of the collaboration in my days of retail, right? I've seen poor relationships become, much more productive when you could just start talking about some improvement effort across some metric that's important to in this case, it's the hospital system and the patient. If you think about the COQ effort of this group, right, if we can find that joint measure that ties patient satisfaction, outcomes over cost in a way that we can collaborate on that, and I know that's a bit off in the future, but if we can do that similar to how we focused on in-stock and retail, I really do think that that's key. But it requires us to be, rigid and not change the importance of talking together, and then also, collaborating on some digitized measure. I hate to keep reinforcing that, but I do see the wonders of that, the benefits of that, and just in our supply chain within J&J. I hate to keep reinforcing that, but I really do find that cleans up a lot of. You can't imagine how much work we do inside J&J that we think is beneficial to the customer. What we really don't know because we don't have the right input coming back from a collective set of IDNs, right? And we're trying to get better at that. And the more we can collaborate, the better. The more we can achieve that.
And I think it is something we need to emphasize, and it comes back to, I think, one of the very first comments related to, again, when everybody turns on the emergencies, which, you might have visibility to one, but what's the collective? What's across? And as you're trying to meet the needs of individual customers, but at the same time, we are all in this together, so having that kind of visibility. We are getting some questions from the audience, so I greatly appreciate that, and I encourage you to continue to send some in. I'm going to ask one more question of all of the panelists, and then we will get into questions. And I also understand if we can't get to every question coming in from today's attendees that there will be an effort to distribute the questions to the panelists and provide some responses post the webinar. So we've touched on a lot of these, but maybe kind of thinking about what you've heard or anything you haven't had a chance to say, I'm going to ask about in what new ways do providers, manufacturers, and distributors, and if you wanted to expand that to other players within the supply chain, you certainly can. But what do these stakeholders need to work together so we can avoid misalignment as we're working to improve supply chain resiliency and performance? And Lisa, I'm going to start with you on that one, if that's okay.
Sure. I think the number one thing that became apparent pretty rapidly was just the lack of knowledge on how the whole supply chain worked. So both, in our industry and with the government, there are a lot of misconceptions on product availability, how much is in the pipeline. We had people thinking, well, doesn't the supplier have, 90 days and you guys have 90 days? And, there was such a disconnect on how actually supply chain in healthcare works that I think one of the things that is really apparent is there's an education that's needed so that all parties can kind of come together and really understand, not necessarily the pain points, but definitely that's one component, but understanding how each one works in the supply chain so that we can better understand the needs, and then we can develop ways to better work together. So I think those are some of the lessons learned. I will absolutely agree with Ruben on connectivity. We have to digitize connectivity between the partners. We have to, I've long said it is atrocious that we can track spinach back to the farm that it was grown in, but we can't track products in the medical industry to that extent. So I think the federal government's got to come in and provide us help there because it's just too costly for the suppliers to take that on their own. But I think, if we had that kind of visibility, it would help all of us plan better and understand kind of how the supply chain works. And then the other thing is just a really robust communication plan for all parties to be able to utilize. I think that is critical. I think it has to be transparent, and there has to be a level of commitment for the parties. So no different than, the government using the DPA funds to help bolster production. If people are making investments and trying to help with the supply chain, so let's talk about stockpiling and living inventories, and there's got to be some level of commitment by the parties so that people can make the applicable investments so that, we are protected in the future. So I think just a robust conversation about that is really critical, because if we let this happen and we don't take lessons from it and we don't, as an industry, really sit down and try to, and I don't think it's a full revamp, but there are definitely some things that I think we can shore up and create a better supply chain. It would be tragic if we didn't learn our lesson from this and really, as an industry, come together and make it way more resilient and much better prepared. And with every instance, you are going to have lessons learned, and I think we have to always look at ourselves internally and as a supply chain on how do we get better every day so that, we are mitigating as much risk as possible for all the parties that are involved.
And if I can, I want to highlight one of the things you said at the very beginning, which is understanding how the system works. Being somebody whose background is continuous quality improvement, you can't fix anything if you don't actually understand how the system works. So I appreciate those comments. And I think also, and we've had a question that alluded to this kind of, will we forget or will we learn and continually improve? Ruben, your thoughts on this question?
So, Karen, I mean, first of all, thank you to the AHRMM group for allowing us to speak on this really, really important topic. So just kudos to everybody who joined. What I would love to see is a way we can build a pipe where we can exchange on information. I mean, in many ways, GHX could potentially be something like that, right? That we exchange on a standard set of information. Something like in consumer where, you know, you have people like Nielsen and IRI that their whole function is to provide a standardized set of consumption data that's shared that's provided by the retailer and then shared with a supplier. Something like that would be ideal, even if we only did it with the top 50, 60 systems. Even if we just started with the Healthcare Transformation Group, that would be ideal, that we're exchanging and transacting on a GTIN. Because the way it is now, it's just, you know, we're guessing, we don't know what you all need, and then we tend to get it wrong. And if I can give you the example of just how we replenish joint reconstruction in orthopedics, you cannot imagine how much inventory we bring in to guess and hope that we get the right sets in there for the surgical case, because we have no idea the dimensions of the individual. We get a manual piece of paper maybe 2 weeks before that gives us an indication, but we still got to bring in every size, nook and cranny, nut, bolt that you can think of. And in many times when we don't have it the night before, we're exchanging parts in the middle of the highway between salespeople. It's just a very broken process, and it's got to be much tighter. Again, I go back to my retail days where I got a forecast, I got consumption, I got inventory. I'm able to replenish it in a much more efficient way.
Thank you very much. And Christine, before we get to the audience Q&A, any final comments you have on that question?
I definitely agree with Ruben and Lisa, and just want to emphasize, I think collective data is super important to identify gaps and surpluses. It will really help us all. And then I go back to that early warning indicator that really is reliant on collaboration. And I think that as we move forward, you know, we do need to rethink the way that we have done things historically or haven't done them. And this does go all the way up to the government in terms of stockpile, but what should that look like in 2020, 2021? And I think living stockpile and across the spectrum is probably something that we'll all need to you know, investigate and consider. And I do think that I just go back to we are all interdependent, and I think that we all have to work together to be super efficient and the best that we can be. So.
Excellent. Thank you so much, everybody, for your thoughts on this. And we're going to jump into questions from the attendees. And I'm going to carry through on this theme of, you know, we've got crisis, we've got resumption of elective or non-urgent care. We've got this quote-unquote new normal, although we are not in Kansas anymore, Christine, I would agree. You know, no slight to Kansas. There's a question that takes us to the next stage, and that is we start thinking through when a vaccine is available and forward thinking a bit. And this can be open to anybody on the panelists. What the question is, what, if any, modeling or preparations are you making for the needles, the syringes, the other kinds of supplies? We know that government will take much more responsibility for distribution, I believe. But, you know, there are these pieces and parts that are needed if you're going to do, you know, a mass vaccination or immunization campaign. Anybody like to take on that question?
This is Lisa. I can just tell you from our perspective, we were on a call this morning with the federal government around the gloves and, you know, where production is on gloves. Is Malaysia coming back up to speed? I feel like they are slowly, but still it's not up to what current demand is. So demand is outpacing supply, and I think will continue. And as we open re-electives and then as we move on to a vaccine, you're only going to see that demand increase. As far as syringes, we have been working with suppliers on that, but those items also have been on allocation for some time, so there's really no ability to build kind of inventory levels. I know they're trying to increase production as they, you know, predict that they're going to need more product, but it's going to be, I believe it's going to be a concern. I would love to hear people's thoughts. The last report, and I haven't read anything real recent, maybe a couple weeks ago, but they had polled the United States and only like 20 or 25% of the people said that they would take a vaccine if there was one available. I found that interesting as well. Would love to hear if anybody's heard updated statistics on that, but that may also be a key driving indicator.
You know, I saw a study yesterday. I'm trying to remember where I saw it, but I think it was a bit more like 40% said that they would take it, so a little bit higher. But when I was reading it and not having heard your statistic, Lisa, I thought that was low. But, you know, I also, you know, understand, and we have a very diverse country. I don't want to stop Christine or Ruben if you wanted to respond to that. Otherwise, we can go to the next question.
Christine, any comments on your end? I mean, I have one on, but
go for it.
Do you have any on your end?
Go ahead.
So, you know, I mean, given that we're one of the, you know, prime developers of a vaccine, and I don't know if you heard the news yesterday, but we're actually accelerating the trials, the phase trials into July. So fingers crossed. Hey, listen, there's a lot of players on this. We want to hope that there's a vaccine, because the only way we're going to really get to a new normal is unless we vaccinate and continue to just practice, you know, the hand washing and we need the better testing, right, out there for everybody. But, you know, our focus right now is to try to get a vaccine that has minimal adverse reactions to people. I can't tell you how focused our pharma team is on this. The speed of us developing this is the fastest I've ever seen in my 35 years with Johnson & Johnson. And we are working with the government as much as we can to make sure that all the components that follow with the vaccine are going to be there as much as we can in terms of supply, because we got to figure out how we prioritize the vaccine and where we put it. But there's a lot of players in this. Moderna, the Oxford study, Pfizer, they're all in very strong lead positions too. And fingers crossed that we have many options when we get there.
Good. Christine, any comments, or we'll move on to the next question?
I'm going to stay focused on N95s and get as much out to the marketplace as I possibly can. How's that?
Okay. I think based on some of the questions we're receiving, there's probably a lot of support for that. So I'm going to combine, in the interest of time, a couple of questions. So my apologies to those who submitted them if I'm not fully asking your question in the detail you had asked. But there's a couple of questions, and one of the things that I've heard a lot is there are always trade-offs. You think about Gartner's hierarchy of supply chain metrics. You know, you make a decision, a conscious decision to have more inventory on hand or less inventory on hand for good reasons, but there are trade-offs for that. So one of the questions has to do with, as we're thinking about, as providers are moving more towards, or thinking about moving more towards having more safety stock on hand, more just in case versus just in time. The question is, how are the manufacturers and or distributors, how can you help providers with that effort, understanding that many providers, you know, have gotten rid of that extra warehouse space. Others, on the other hand, are creating their own consolidated service centers. On the other side, there was a question related to if there is more domestic production and more efforts to lower risk, that also comes at a cost. And so some thoughts in terms of how to, how do we balance that? Who pays that price? Is that something we can do across the system as opposed to, the burden on one end or another? So I've kind of asked two questions. Maybe they're combined, or maybe just in my head they're combined. So I'm gonna open it up to the panelists, and you can answer any kind of combination of those two questions you'd like to. Anybody like to go first?
Karen, let me give it a shot on the inventory piece of it. There's a lot of inventory in the pipeline, right? There is a lot of inventory in the pipeline, hundreds and hundreds of days, if I can just specifically talk about orthopedics. The issue isn't that we have not enough inventory. We get it wrong at the SKU level, right? And that's where you need to collaborate and exchange on what the value because, if we collaborate more, and the takeaway is stronger on a certain SKU, then you can pump that SKU with more inventory. And then take it off where the areas where it's not needed. But that takes a discussion. It takes a discussion with their perioperative clinicians, with the supply chain planner at the hospital system. Those are the processes that don't exist, right? And before COVID, I got to tell you that people were busy, right? So people were like, well, they'll get to their meeting, maybe they won't get to it. But once there's a disruption, now everybody wants to join, and I think that's what we need to see going forward, because it's not that there's not enough inventory. There's plenty. It's just that we got it at the wrong SKU and at the wrong location, and that's what we have to try to adjust.
And I might add, go ahead, Christine. Go ahead.
I was just going to add, because that we saw something very interesting as we moved through, February, March, April timeframe with the SKUs on N95. In that, as more and more clinicians were wearing PPE, our historical split between, and everybody probably knows these SKUs, which is I still find very comical, but 1860 and 1860S, the S being small, for the past 5 years, our mix has been super consistent, maybe 20 years, right? More 1860 than 1860S. And what we saw happening as more and more clinicians started wearing this was a shift in the demand for smalls versus the regular, and that you can't, to Ruben's point, you can't turn on a dime on that. And so if there's some way that we can, either to your point, Ruben, about consumerism or learning from consumer or having that real-time data, or starting to see that, we can probably react a lot quicker in that. And so that was just a phenomenon that occurred that I thought I should comment on that probably touched a lot of people. And we've since been able to, make a shift, and this month we should feel that, but that doesn't happen quickly. So especially in the midst of chaos.
And I think that's a very good point, and thank you, because that answers one of the other questions from one of the attendees. And, it is a matter of kind of this contingency planning and understanding what your needs are. I know that within hospitals, supply chain and clinicians have probably never communicated as much as they can. Are there things that we can be doing to think about proper use of PPE? Certainly kind of understanding what is the potential need out there and giving you, it's not just that you need product X, but you need product X in size blank, et cetera. This goes so fast. We have about a minute left. So I'm going to quickly jump to Lisa, to Ruben, back to Christine, 30 seconds. Well, I guess it's 20 seconds. Final comments before we wrap up.
This is Lisa. My final comment is just I appreciate everybody being on this call. I will tell you that the response, obviously there are things that we can do better, but I just want to call out all the hard work that people put into responding to the healthcare, and I don't feel like probably the healthcare facilities feel that the response was enough, and it wasn't. But I will tell you, we saw people come together, competitors come together, doing whatever they could to take care of customers that weren't your customers. It was really heartening to see kind of the industry come together and really do what was best for the patient and the healthcare workers. And so I just want to say thank you for that, and thank you to all of the healthcare providers out there for continuing to do what you do. This has not been easy for you, and we really are appreciative of everything that you guys have done to take care of these patients. So that is what I would end with.
Thank you, Lisa. And just real quickly, folks can stay on. We're going to run probably a couple minutes late, but before, in case we lose folks to other meetings, I do want to say thank you as well to the CQO movement sponsors, Vizient, Cook Medical, Health Trust, Premier, Nexera and Acurity, and Pampers. Christine, you've got some final comments?
I just was going to say, as I look over the last few months, I have seen an incredible amount of leadership and agility in this industry, and heroism really along, not just on the front lines, that is where it's most important. And you see this all over, but also on behind the scenes. I know that we've seen some incredible things happening from our manufacturing teams and some of the hurdles and the push that they've done, and just very proud to be amongst everyone who's working so hard to get through this. So,
thank you, Christine. And Ruben, some final words from you.
I just love this industry. I mean, anything that helps the human condition with, a centered, a focused effort on patient centricity, working with healthcare partner, IDN, hospital heroes that are on the front lines, and seeing the hard work. I mean, Lisa and Christine said it very nicely. It's just it's an amazing thing. Like the pandemic has opened up a lot of eyes, and I think it'll lead into new ways of working, which is in an unfortunate situation, something that's going to come good out of it. So thank you.
Thank you. And I want to, the perspectives of all of our panelists today, so very informative and so very focused on how we can all get better together. I want to thank everybody who was able to join us today. We do have another webinar coming up, and you'll get information, and this is more of the provider perspective, and then I think on this whole issue, and then we kind of put the pieces together. But it is this kind of communication, as all of the panelists have mentioned. So I want to thank you again. If your question did not get answered, I know that the AHRMM staff is going to work with the panelists to try to get some responses to you. And you can add it in the Q&A box now if you didn't ask the question, or you can email it to AHRMM, AHRMM, @AHA.org, and we'll get those back. Thank you again for taking your valuable time, because I know how very busy everybody is. And thank you again to the panelists for joining us. I'm Karen Conway. It's been a pleasure to be with you today.